Okay, let's unpack this. Have you ever stopped to think about how an entire specialized field um, gets built? Not really top down, but more from the ground up.
Yeah, like who are the people who first spot a need, a growing need in patient care, and actually say, hey, we need to define this.
Right. We need standards, we need a community, we need to push the knowledge forward.
It's a really fascinating process, that mix of recognition and, well, organization.
And today we're taking a deep dive into exactly that kind of journey. We're looking at the evolution of vascular nursing.
Our source material is this really insightful chapter. It's called The Evolution of Vascular Nursing, and it's written by Jean Doyle.
And the key thing here, what makes it unique, is that Doyle was actually one of the nurses there right at the start.
Wow, okay. So we're basically getting the origin story from someone who, well, who helped write it in real time.
Exactly. So our mission today is to explore how this nursing specialty came about, maybe highlight some key milestones,
Learn about the people who really championed it.
and understand why that focused effort was, and still is, so vital for patient care.
Yeah, get ready for some, I think, powerful insights into how passion and organized effort can really formalize a critical area of practice.
So what's fascinating here is that the need for this specialized nursing didn't just appear out of thin air from some academic decree or hospital memo.
No, not at all. As vascular medicine and peripheral vascular surgery really took off over the last, say, 50 years, the nurses caring for these often very complex patients, they just naturally developed specialized knowledge. They had to.
They were right there on the front lines, weren't they? Seeing the unique challenges these patients faced day in, day out.
Exactly. And the chapter tells us that in the early 1980s, a core group of these nurses, and I love how this source describes them, as self-proclaimed vascular nurses. They took a really crucial step.
Self-proclaimed, I like that. What was the step?
They realized that nursing itself needed to define what this emerging practice actually was. It wasn't enough to just, do the specialized care.
Ah, okay. They needed to articulate it, put it into words, formalize it.
Precisely. They saw a gap and decided we need to fill this. We need to formally validate our own expertise.
And that led to actually forming an organization.
Yes, in 1982, it was initially called the Society for Peripheral Vascular Nursing, SPVN.
SPVN.
And that act, just forming the society, that was a powerful statement. It really started to solidify vascular nursing as its own distinct specialty.
And the chapter even lists the names, the key people who were charter members, the first officers, and the board of trustees.
Yeah, names like Mitzi Andrews-Akers, Patricia Baum, Nancy Jesenkowski, Sheila White-Flores as officers.
And then on the board, Jean Doyle herself, Victoria Fahey, Jacqueline Helt, and Patricia McGlone.
These were the pioneers, weren't they? The ones who took that collective knowledge and channeled it into a formal structure.
They really were the driving force behind those first crucial steps.
It really makes you think, though, how does formal organization fundamentally change a clinical practice area?
Good question.
It takes it from being, maybe isolated pockets of expertise here and there,
To a recognized collective body of knowledge, something that can be shared, built upon, taught.
exactly, which naturally led to them refining their identity a bit.
Right. We see in the chapter that the organization was renamed in 1990.
Yep, to the Society for Vascular Nursing, SVN.
SVN.
Yeah,
And with that name change came a clearer focus on their goals.
definitely. Their vision, as the chapter states it, is to be the premier vascular nursing organization. And the focus, improving outcomes for people living with vascular disease.
That's incredibly patient-focused, very clear.
And their mission statement backs that up. Provide a professional community focused on advancing care through excellence in clinical practice, education, and research. Practice, education, research, the trifecta.
And underpinning all of that, they had core values.
Yes, excellence, respect, and advocacy. And Doyle points out these values really shaped the quality of care over, well, the past 3 decades, speaking from when the chapter was written, of course.
What's impressive, too, is that they didn't just look inwards. The chapter says SVN quickly became a key player in the wider vascular field.
Absolutely. They weren't siloed, they actively collaborated. For instance, endorsing major guidelines like the ACH 2005 practice guidelines for PAD.
PAD, peripheral artery disease.
All right. And they contributed to that big 2012 key data elements document. Shows other specialties were saying, yeah, we need the nursing perspective here. It's vital.
Okay, here's where it gets really interesting for me. Almost right after forming, they zeroed in on defining who was actually qualified.
Yes.
Yeah.
It's amazing. We learned that in their very first 5-year strategic plan, way back in 1983, they flagged specialty certification as a critical need.
Right away. They knew formal organization wasn't the whole story.
Exactly. They needed a way to credential individual competence, to say, this nurse has demonstrated this specialized knowledge and skills.
And that push, that drive for competency assessment, it eventually evolved into the Certified Vascular Nurse Credential, the CVN.
Right. They set up the Vascular Nursing Certification Board to develop and administer the exam initially.
Okay.
The chapter notes that later on, the administration part was taken over by the American Nurses Credentialing Center, the ANCC.
Ah, the ANCC. That's a big deal in nursing certification.
It is. It was through their cardiac vascular nurse examination, but importantly in collaboration with SVN, so SVN stayed involved.
And that move to ANCC, that signifies wider recognition within the whole nursing profession, doesn't it?
Absolutely. And Doyle's chapter highlights something really crucial here.
What's that?
The drive for this certification. The need to define what a competent vascular nurse knows and does. That was the fundamental force behind creating and publishing the core curriculum document itself.
Get out, the very book this chapter is in.
Yes. Think about that chain reaction. The goal of setting a standard directly led to creating the definitive educational textbook for the entire field.
Wow, that's a powerful example of how needing standards can actually drive knowledge creation.
Isn't it just? Which logically brings us to defining what that competence looks like in everyday practice.
Right, the scope of practice. The chapter gets into that too.
It does. It details how they establish the scope of vascular nursing practice. Because, these nurses work everywhere.
Hospitals, clinics.
Acute care, outpatient clinics, community settings, yeah. So to provide a consistent framework across all those places, SVN experts worked with the American Nurses Association, the ANA.
Okay, collaboration again.
Always. And together they developed the scope and standards of vascular nursing practice. The chapter mentions the 2004 edition and that an update was expected around 2014.
So this document, it's basically the map for the specialty. It defines the territory.
Exactly. It lays out the patient population, the expected behaviors, responsibilities, functions, skills, both for the generalist vascular nurse and the advanced practice nurse.
And the chapter stresses that every vascular nurse should be guided by this.
That's the message. It's the foundational document for practice.
And they didn't just stop at the broad scope, did they? They kept refining.
No, they kept drilling down. The chapter explains that SVN's Practice and Research Committee is always working on developing more specific guidance. The goal is always improving clinical outcomes and enhancing continuity of care.
Makes sense. Do they give examples?
Yeah, it mentions published guidelines, like one for patients having endovascular repair of abdominal aortic aneurysms, AAA repair.
Yeah.
That came out in 2009.
Okay.
And then subsequent guidelines for things like carotid endarterectomy and carotid artery stenting available on their website. So constantly refining the how-to based on evidence.
Which, of course, means you need ongoing learning. You can't just learn it once and be done, especially in a field like this.
Absolutely not. Doyle points out that vascular nursing is ever-evolving. Think about the technology changes alone. It makes continuing education non-negotiable.
So how does SVN handle that, building the knowledge base?
Well, their national convention is a huge piece of it. It started really small, just a half-day program in San Francisco back in '83.
Wow, half a day.
Yeah. But it grew into an annual 2 to 3 day comprehensive event. They bring in international experts from across the whole vascular spectrum. State-of-the-art topics.
And I bet it's more than just lectures, it's networking too.
Oh, definitely. The chapter mentions it's a key networking forum, connecting nurses, sharing practical knowledge, the stuff you learn from colleagues.
Crucial. What else on the education front? Publications.
Right. Another major pillar. What started as just a simple newsletter to keep members updated, evolved into the peer-reviewed Journal of Vascular Nursing. It's a quarterly journal now, with an editorial board of expert vascular nurses. It's recognized as a core resource.
That's a significant leap, isn't it? From newsletter to peer-reviewed journal shows real maturity in the specialty.
It really does. And of course, they use various electronic media, their website, www.svnnet.org, to get information out effectively.
And it all ties together, right? The education, the core curriculum, supporting certification.
Exactly. The chapter emphasizes that link all these educational efforts, strongly support nurses pursuing certification as a tangible way to demonstrate excellence.
So education, publication, certification, all working synergistically to build and validate expertise. Makes sense.
It does. But SVN's reach wasn't just internal, focused only on its members.
Ah, okay. They looked outward, too.
Very much so. The chapter highlights their significant work in patient and community education, taking that specialized knowledge out to the public.
That seems vital, especially for vascular diseases where awareness can be low.
Precisely. As our understanding of these diseases and the risk factors grew, vascular nurses really stepped up, promoting awareness, prevention, arterial, venous, lymphatic diseases.
And the chapter gives a specific example of this outreach.
A really powerful one, the A Step Ahead program.
A step ahead. What was that?
It was a nurse-managed peripheral artery disease, PA, public screening and education program.
Nurse-managed screening.
And get this,
Wait.
they launched it quite dramatically in 1993, not just at their convention in D.C.
Oh, but where else?
Simultaneously at a press conference right there on Capitol Hill.
Wow. Taking public health advocacy straight to the lawmakers? That shows some serious initiative.
Doesn't it? And the impact wasn't just symbolic. We learned this program actually served as the framework for a big community-based research study.
A research study came out of the screening program.
Yes, cited in the chapter. It measured things like public awareness of PA, how well doctors were recognizing it, and how intensely it was being treated. Real-world data.
And what did that study find? Anything significant?
The key finding was pretty stark. It clearly pointed to PA being underdiagnosed, especially in primary care.
So people weren't getting diagnosed early enough.
Right. And this finding, generated from a nursing initiative, was so important that it actually spurred a 2-day meeting in 2003.
A meeting where?
At the National Heart, Lung, and Blood Institute, NHLBI, part of the NIH. It was a PAD public education strategy meeting.
And SVN was invited.
They were right there at the table. One of 17 professional societies and public health associations invited to this national strategy discussion because of the groundwork they had laid.
That's incredible. You connect the dots. Bedside nursing knowledge leads to a public screening program, which generates research data, which influences national health strategy.
It's a perfect example of impact far beyond the individual patient interaction. Truly powerful.
And all this work, it must be underpinned by a commitment to research itself, right? Advancing the science.
Absolutely.
Okay.
The chapter is clear on this, calling nursing research the foundation for evidence-based practice. And interestingly, the key to professional accountability.
Accountability. How did they formalize that commitment?
SVN actually has a position statement on vascular nursing research.
Okay, what does that say?
It basically outlines the role of all RNs, not just dedicated researchers in the research process. Things like clarifying clinical problems that need study, critically looking at research findings.
It's in participating in data collection if possible.
And just fundamentally understanding the value and relevance of vascular nursing research. It tries to make research part of everyone's professional responsibility.
So embedding it in the culture. Did they do their own research too?
Yes, they did. Back in the early 90s, and then they replicated it in 2001, SVN conducted its own Vascular Nursing Research Priorities Delphi study.
A Delphi study. That's about getting consensus from experts.
Exactly. The goal was to figure out, okay, what are the most critical research questions we need answers to in vascular nursing right now? And then, hopefully, stimulate clinicians and experts to actually do that research.
Helping to focus the research energy where it matters most for patients. Smart.
Very. And they didn't just point the way. They put their money where their mouth was. They offer grant funding for research proposals, reviewed and approved by their own research committee. Tangible support.
Okay, so let's try and summarize. Looking back from when Doyle wrote this chapter, reflecting on SVN's journey over its, 32-year history at that point?
Yeah, it's really a story of consistent, dedicated work, defining the scope, setting the standards for vascular nursing. The chapter really credits the collaborative work of SVN members for significantly boosting the quality of care.
And it stresses that SVN members became recognized experts and that with that recognition comes responsibility, right, to keep charting the course.
Yes. And collaboration is still a key theme, looking forward to working with other vascular specialty societies, doctors, surgeons, techs.
All aiming to optimize patient outcomes through shared projects in education and research.
And those core values, excellence, respect, advocacy, they're presented as still being the guiding principles. The chapter mentions their strategic priorities up through 2015 were focused on SVN being the go-to resource, advancing the science, and positioning members as advocates for both nurses and patients.
But it's not presented as mission accomplished, is it?
No, not at all. The chapter is quite clear. Despite all the achievements, the specialty is seen as a work in progress. There's always more to do, striving for professional growth, but always keeping patient needs front and center.
It's described as a dynamic journey. Sounds like it has both daunting challenges and exciting opportunities ahead.
Definitely. And Jean Doyle's final words in the chapter are really a call to action, aren't they?
What does she say?
She encourages nurses in the field to constantly keep pace with practice changes to ensure top-quality care. And she positions resources like the core curriculum as springboards for getting certified, that cardiac vascular nurse certification, calling it a tangible indicator of expertise.
So keep learning, keep validating your skills.
That's the message. Ongoing dedication.
What an incredible story, though, from just a handful of nurses realizing they shared a specialized practice area.
To a formal society that actively shapes standards, drives education, fosters research, and even influences public health policy.
It's a really powerful blueprint, actually. Shows how a professional group can organize and make a massive difference in patient care and the wider healthcare world.
It really is.
And it makes you wonder, thinking about this journey of defining and formalizing a specialty, how does that resonate with areas you might be involved in?
Yeah, are there maybe emerging needs or areas of expertise in your own work, your own field, that could benefit from that kind of focused, collaborative energy?
It's something to think about.
And one last thought. If vascular nursing is truly this dynamic journey, always adapting, always evolving with new knowledge and patient needs, what does that really tell us about expertise itself? Is it ever a fixed point you arrive at?
Or is it fundamentally a process, a continuous journey of learning, adapting, and growing, no matter the field?